Dr. Danielle Lidoff, and I am here to talk about an elimination diet. And a lot of people think, oh, why would I ever do an elimination diet? And there's a lot of reasons to do an elimination diet. Autoimmune diseases, thyroid, you can do an elimination diet if you have adrenal insufficiencies, and a lot of people with digestive issues like Crohn's or celiac disease, even SIBO. And so what is really involved in an elimination diet is we're trying to heal the gut. You may have heard about leaky gut, and leaky gut decreases our ability to absorb food. And when we can't absorb our food, when we can't actually digest our food and absorb it, then the nutrients don't go to the rest of our body, and that's when the rest of our body break down. A lot of us will try and fix those pieces of our body symptomatically with other kinds of medications, but really the true cause, the root cause, is that the gut is not functioning appropriately to give you the food that you need. The gut can get damaged by stress, and stress can be environmental toxins, it could be processed food, it could be lack of sleep, right? It could be emotional issues like your really awful boss or fights with your teenage daughter. Those types of things are going to decrease our gut's ability to function and thrive. So true leaky gut happens when we damage the lining of the gut. So the lining of the gut should be really tight. When you think about tight junctions, right? Cells should be really tight like I have here in my hands, right? Because we have a very thin lining of the gut, and so on the inside of the gut is where all of our food goes, and on the other side is the blood system. It's our blood supply. So when we have a really tight system, we have the digestive enzymes and the ability to digest our food, and then those chemicals pass through into the bloodstream. But when we're stressed out, when we add stressors that cause inflammation, that swells, and when those cells swell, they're going to have permeability, or the junctions between them don't get tight. Well, then the food doesn't get digested, and big pieces of food slide out right into the bloodstream. And when you slide out into the bloodstream, you have whole pieces of chicken and apple and wine or whatever you're drinking, chocolate, that goes right into the bloodstream. And the bloodstream, our immune system sees that as a full protein. Viruses are full protein. Our body is doing its job to say, that is not me, I need to fight that. The more we fight that, the more inflammation we get, and it creates a cascade of illness. And we get more and more symptoms in our body that might not be specific, right? You might end up getting more colds, you might end up having asthma, you might have more digestive bloat, gas, pain in your stomach, those types of things. And that's all coming from not having the appropriate immune system or the appropriate function in the gut. So we can heal that with an elimination diet. We basically bring you back down to letting things rest and repair, removing those stressors. I myself have been through an elimination diet. I have brought through many patients through an elimination diet. Elimination diets in themselves are not difficult, but there's a lot of pitfalls with them because they're very different from how we're normally living these days. And we need guidance, or I feel that people do much better when they have guidance through this elimination diet to get the outcome you're looking for, to really heal and seal the gut, to not fall backwards. So to do an elimination diet, we can explain it, but we also have someone at Battleborn Health. We help you go through it. We teach you the easiest way to get from point A of not being in that healthy place to get through that elimination diet, heal and seal the gut, so that you can get on and do what you need to do in your life and be stronger than yesterday.